One of the rotations you'll get to do is outpatient surgery, so you'll get to do a lot of starts. Usually you want to have all your equipment, and sometimes they'll have it all together or all separate. You need a start pack, you need your needles. If you're going to have a patient in surgery, you want at least a 20 gauge. Don't get in the habit of knowing the colors, but nurses will do that because we know pink is 20, okay, green is 18, but you want to look and read and see, make sure you have the right size. The two common ones in Corpus that we see are the B-Bron and the J&J, but it doesn't matter, any kind of IV catheter. Some outpatient surgery units will use what we call an extension sets, okay, and you'll want a flush of some kind. If it's pre drawn up, it's nicer because you have it in the kit ready to go. Okay, so usually I'm just going to pretend I'm starting my IV. And I'm going to apologize, I have nail polish bright red on. I have long nails because I haven't been in clinical this semester. So, in case, ladies, y'all are noticing that. No, policy is still short nails. Okay, so I have opened my start pack, and I'll do this demo of this needle first, and then I'll use the other needle. But I go ahead and get everything open. I kind of considered this my sterile fill, the pack opened. Okay. And I'm going to get my extension, and I just go ahead and get everything ready. Okay. I don't have to clean anything because everything's sterile, right? Mm-hmm. But I'll point out what parts I keep sterile. Okay, put my gloves on. I washed my hands, put my gloves on. Mm-hmm. Well, no, I want to put my tourniquet first. Find my vein. You want to start low, most distal, and then move up. But if you're sending a patient to surgery, you probably don't want to start in the hand. You want to start in the upper arm. But usually you'll start low and then move up. Okay, so let's say we pick, you want to palpate, feel for a soft vein. Usually what we tell students is you want to see your veins. So if you put a tourniquet on my hand and pumped, you can see some really nice big veins. But what you would want to be careful with is anything that has a knot. And so I have a big old knot right here. So they always want to start an IV there. They can never get them started, okay? So put a tourniquet on, find a good vein. It's up and then if you want to, you can take your tourniquet off, get everything ready. Okay, so once you put it on, I kind of give myself a minute as my time limit. So if I can't start an IV within a minute, then I'm in trouble. Okay, put my gloves on. Because the longer you leave the tourniquets, what's going to happen?
Circulation.
Yeah, blood flow is going to stop, and then eventually the vein's going to collapse. Okay, I do something called defatting the skin. I use alcohol to clean. Sometimes that will help glisten, and it makes the vein pop up even more. So it's just cleaning off like the first layer of dry skin. Okay, I'm not going to get tape out, and I'll tell you why in a minute. This is my dressing, my 2x2s. We want to ask the patient if they're allergic to any prep. ChloraPrep is the newest stuff we're using. We don't use betadine as much, but still, in case you're working in a hospital that's using betadine, you want to ask. If they don't know what betadine is, what can you ask them? Shellfish, okay. Or I had a patient once tell me, oh, not allergic, not allergic. Ah, my tourniquet fell off. And when I put the stuff on and she saw it was brown, she goes, oh, that's that brown paint. I'm allergic to that brown stuff. So that taught me early in life to say the brown stuff. Okay. When you take out a needle, you want to find the bevel. On this product, you know the bevel is up. When you see this little device here, that's pointing up. You also look at the end, and the bevel should be pointing up. Okay. You don't want to take this apart and pull it apart because then the needle's going to slide in and out. grab it by the gripper pads, put your finger up on top to hold it in place. I usually pull down on my vein, and then I go for my vein, and you can either go on top or on bottom. Once you get the blood return, you know what? They're not open. Open them. There's my blood return. Okay, I push it in a little further, and then I use my top finger to slide off. Right. And I'm pulling back on the gripper pad. And that puts the stylet in the middle. Okay? All right. Then I have my device ready. Okay, and on these mannequins it's going to leak, but on a real patient, if you put pressure right below the needle, right on the hub, twist, and then attach, you should be able not to have a bunch of blood, but this mannequin's going to leak. So, your first stick is usually bloody like this.
What might you want to bring in the room for your first couple sticks?
Extra gloves.
A towel.
Yeah,
towel.
a towel.
Under the arm.
Actually,
Otherwise, you're changing all your whole linens.
yeah. And actually, what I do, I'm going to pretend I take these gloves off there instead. I put a 2x2 underneath before I attach, and that way I'll catch the blood, okay? Take my tourniquet off. Now, a real patient's not going to keep their hand real still, right? So you have to really hold on to your device. And at the hospital, a lot of them are using this little device to hold it in place. So let me show you how that works. The reason I didn't tear my tapes was because this is the tape you're going to want to use. You pull one piece off and, okay, put one like that right on the hub. Now it's stabilized. So my extra alcohol that I bring in, of course I would have gloves on. I can clean right here. See how it's soaking up? And because I hate to leave an IV all bloody. Okay, so I'll use 3 or 4 alcohols, really clean it up. And then the other thing I want to do is to flush my line before I tape it all down, because if it bubbles up here, it's infiltrated, or if the patient's complaining of pain, that's infiltrated. So why tape it all up and then fine? So as long as it flushes well, then you can also check back for a blood return to see that little blood return. That tells me I'm in a good site. But again, I'm going to flush. And right towards the end of the flush, I go ahead and clamp at the same time I'm pushing in, and then I'm clamping at the same time. And what that does is it pushes out the blood, and it doesn't allow the blood to suck back into the end of the catheter. Okay, just a trick I learned years ago to help save my IVs.
At the same time you're pushing, you're locking.
If you're pushing and locking at the same time. Your clear tape. Now remember when you're taping, if you put the tape over everything and someone has to come and replace, then you're making, so I do it right over the hub. And I'm just dressing the area right below the hub. Now what I also do, I do believe in a lot of tape. So now I get my regular tape. I won't leave it like this. I'll put tape on the, right here where it's attached. And then I'll run this up, depending on how it falls. And I'll tape it here also. But again, what I don't want to happen is I don't want the linens to catch hold of the hub or the end here. And then I don't want this to be flying around where it's going to catch on something. So again, I'll put tape. So even though I don't put tape initially, I put plenty of tape at this point. Okay. Now, how I could have prevented all that blood leak, like I said, when we lower these bags in a minute, it won't bleed back so much. Okay. What would I need to document? I'm going to document. Okay.
The date and the time.
The date and the time. So if this device Sometimes they'll have a little date and time here. I probably threw it away. I'm so bad about this. Usually what I use in the hospital, I do this stuff. If today is Thursday, Sunday, we can change the needle in 3